All right. Hello, everyone. Can everyone hear me? Yes. Okay, great. Thank you. All right. So again, as you can see, if you want, just for those who are new to Zoom, and if you don't want your full name to display, you could change your name just by clicking on the three dots on the right. And you could just, if you want to just display your first name or first name and last initial, that is up to you. And before I forget, let me start recording this. Let me stop the share for a sec here. All right. All right, good deal. So again, thank you for joining me on this afternoon, at least over here. There might be some people overseas, but just curious. I know so far we don't have, we have about, looks like 19 people. Can you type in to let me know where you're from? If you could just type in the chat, just curious where in the United States or other countries people are. Just I'm in Matthews, North Carolina, which is pretty close to Charlotte, North Carolina. All right, so we got Eugenia from London and Jen from Toronto and Maryville, Tennessee, Karen, Rebecca from Aurora, Indiana, Deborah, Wisconsin, Faith from Vancouver, Claudia, Athens, and then Kat from the UK, and you're very welcome for hosting this, and Bruni from New York City, and then Lethbridge, Alberta, Canada is from where Daniel's from, and then S. Nunley from Los Angeles, California, James from California, Nancy from Rochester, New York, and yes, you're welcome, Jen. Yeah, yeah, you are very welcome. And then Lucy from Montreal, and then Stephanie in Austria now, but normally London. All right, great. All right, thank you for that. Just all right, so I think again we're streaming on YouTube as well. So just like last time, I'm gonna first focus on Zoom, and then we'll see if, as far as questions go, and then I'll go back and forth. But yeah, so let's go ahead so let me get the PowerPoint up. All right, so before starting, just all right, so again, obviously I did this last time too, but just, so obviously you could see each other, which most people probably know, but I know some people new to Zoom. And again, I have everyone muted to keep the background noise down. And last time we pretty much used the chat feature for Zoom and YouTube Live, and even with that, we weren't able to get to all the questions. A little bit of a smaller crowd this time, so we might actually be able to get to all of them. We'll see. But yeah, I figure just the chat is quicker, where if we get people live, it might be more challenging, but I guess we'll see how it goes. And, just like I did last time, I'll try to answer as many questions as I can, and just, try your best to make questions, I'm sure, to the point. And just keep in mind that I can only give specific recommendations to my patients. And when I say I'm going to try my best to diversify, that means that if like someone, the same person asks a question like five questions in a row, or has five questions in a single chat, I might jump around just to make sure I get to everybody at least once. And we'll see. Like I said, I'll try my best to get to everybody, period, or all questions, period. But we'll see. Last time, as I said, that didn't happen. And I could stay on to about 3 o'clock if necessary. So, and also I showed this slide last time. So just there's a few different causes of hyperthyroidism. So of course, Graves' disease is the most common cause of hyperthyroidism. And then toxic multinodular goiter. I was hoping I might be able to get the blog post last week. I'm kind of glad I didn't, because I've still been working on it. I think it'll be even better, but almost definitely should be coming out this Thursday. May 14th. So if you have toxic multinodular goiter, or even if you have multinodular goiter, not, just even if it's not toxic, but if you have multinodular goiter, presence of hyperthyroidism, if you're not sure what you have, then you might still want to read that blog post. And then there's subacute thyroiditis and hashitoxicosis as well, which is Hashimoto's thyroiditis. That's Hashimoto's having the antibodies to Hashimoto's, typically negative for Graves' disease as far as antibodies, but you get the release of thyroid hormone into the bloodstream. And I've written articles on all of them. Toxic multinodular, I have one on multinodular goiter from a few years ago, but doing an updated one. But I have separate ones, plenty of information on Graves. I do have an article on subacute thyroiditis, again, an article on hashitoxicosis. All right, and then we're going to talk a little bit about thyroid eye disease just for about 5 minutes. So also, I know just as the case with last time, a number of people emailed questions. So if you emailed question, what I'm going to ask you to do, if you're not on the call, unfortunately, I probably won't get to that, because last time, again, I just got to I just answered live questions, and same thing, I didn't print up, or I don't have any email questions handy, just because, again, last time I didn't have time. I try to prioritize the live questions just to reward the people who are on the call, and then I might do an evening one next time just to accommodate those who can't make this one. But if you emailed a question, what I would do is copy and paste the question into the chat, because that's how I'll be answering questions. Just want to make sure, because last time I know there were a few people that emailed questions, and I think also were on the call, at least one or two that emailed and were on the call, but I think they thought that I was gonna. Anyway, so I put on the email that I sent this time that I don't plan on answering questions that were emailed, but that I still got a number of questions that were emailed. So yeah, just if you're on live, just type in your questions, even if you email them. And then, like I said, I'm going to try to do an evening one sometime this month for those, maybe like an 8 o'clock, call, just for those who are unable to attend the day call. So I'm just going to talk about thyroid eye disease for a few minutes, just because we had last time a number of questions, a good amount of questions on thyroid eye disease. And I know not everybody has thyroid eye disease. When I was dealing with Graves' disease in 2008, 2009, that wasn't an issue. I did not have at least noticeable thyroid eye disease. But again, it's very common with people with people with Graves' disease. And so I figured I'd just dedicate a couple of slides. So there's, I believe, 2 slides dedicated to thyroid eye disease. And if there's any questions, of course, let me know. But so TED, or thyroid eye disease, is common in people with Graves' disease. And it involves the same autoimmune process as Graves. So in other words, the same triggers that causes Graves' disease causes thyroid eye disease. And as a result, the goal is to still find and remove the triggers. And you might have heard, I actually have an article on the triad of autoimmunity, if you haven't heard me talk about this, but essentially there's 3 factors that are necessary in the development of any autoimmune condition, including Graves. And that's a genetic predisposition, which we can't modify, but we can find and remove your triggers. And then the leaky gut, also known as an increase in intestinal permeability, also seems to be a factor. So we want to find and remove triggers and heal the gut. So what can you do while finding your triggers? Again, this also applies, I guess, some of this to Graves, but really the next slide is mainly for, again, there's maybe a few things that will apply to Graves, but it's mainly meant for thyroid eye disease, because again, a lot of people just have, if someone has severe thyroid eye disease, like severe symptoms like double vision and, just, it's like severe bulging, then one of the recommendations may help, but like natural solutions is probably not going to completely reverse someone who has severe thyroid eye disease, but definitely focus on diet and lifestyle factors. So you want to eat whole, healthy foods, improve stress handling, get sufficient sleep, and then there's some supplements. Again, the goal is not to, I don't want you to I'm not suggesting you need to take all these, or honestly, of course, you don't have to take any of these, but that's what people ask, like, what can I take? Like, what supplements can I take? So you want to do as much as you can through diet and lifestyle, and try to find the triggers, underlying imbalances, heal the gut. But in the meantime, while doing all that, you want to make sure that you have healthy omega-3 fatty acids, really just a healthy fatty acid profile. But EPA, DHA, that's, and again, the dose does make a difference. So I usually recommend fish oil. If someone's a vegetarian, they can take something like algae oil. There's also krill oil, not if you're a vegetarian, but there's krill oil. But fish oil definitely has the higher amounts of EPA and DHA. You need healthy vitamin D levels. So vitamin D, again, this is, both of these really are for Graves too, not just thyroid eye disease. So you need healthy fatty acids, healthy vitamin D levels. And, so I clustered these three together: selenium, alpha lipoic acid, glutathione. So selenium is a cofactor for glutathione. Alpha lipoic acid also can help with glutathione production. And then you could also just take glutathione, like a liposomal glutathione or an acetylated glutathione. Turmeric, most people are familiar with turmeric or curcumin. So that's great for overall inflammation, but also in some cases can help. Probiotics. So when we think of probiotics, we think of the gut, or a lot of people think of the gut. Again, probiotics help to modulate the immune system as well. And so some people take CBD oil, or some people ask about CBD oil. And I see that hit or miss, with CBD oil when it comes to thyroid eye disease. So some people will take it and they'll notice good results. Others will take it, they don't notice any difference. But again, just keep in mind, you have to find and remove triggers, correct underlying imbalances. So, sometimes, taking, even if someone took all of these, it's not going to, address the cause of the thyroid eye disease. And then there's a new medication. So even though we're focusing on natural treatment solutions, there's Tepeza, something that came out earlier this year. I actually wrote a blog post, I think it was in March. So you could check that out on my website. And so that's an option too, especially if someone does have severe thyroid eye disease, where again, the natural treatment methods are less likely to work. And again, they might still work to some extent, but again, if someone has, debilitating thyroid eye disease where they're, having, double vision all the time, and again, the bulging is severe, Tepeza might be able to help. From what I heard, it's outrageously expensive if you don't have health insurance. But again, figured I'd bring that up just as an option, and it involves intravenous infusions. I think there's 7 of them, like 3 weeks apart. Again, I wrote about it in that article or blog post in March. If you're interested, if you don't know anything about it, definitely check out the blog post. So far I've had, I think, only one of my patients, I think, at least mentioned that he's on the Tepeza. Again, it's brand new, like, a couple of months, but I think he just started, like, when he emailed me, which wasn't too long ago, he just went through his first treatment. So don't have a whole lot of feedback on that, but yeah, so anyway, that's all I really want to talk about with thyroid eye disease. I really want this to be about your questions. I didn't want to take up too much time, but since last time there was a lot of questions on thyroid eye disease, I figured I'd put together a presentation, a brief one, not a full presentation, but again, I didn't want to spend like half an hour talk about thyroid eye disease and then eat up into the questions. So again, for those who are new, so we've had more people trickle in. Again, if you're new to Zoom and you want to change your name, just hover over your video and there's 3 dots if you don't want your full name to display. And then you just click on the 3 dots and click on rename. And then you could just, if you want to just, again, that's up to you. So, and then, like I said, I'll be going until about 3 o'clock, depending on how many questions, as long as there's enough questions. And so a little over an hour, like an hour and 15 minutes. And then we're streaming live to YouTube. So I'm going to start with Zoom. Last time, most of the questions were on Zoom. There are a few on YouTube, but I'll start with Zoom. And then maybe after like 30 minutes, just check YouTube live and just see if there's any questions there. And all All right. And then again, just for those who trickle in what late, type in your, we're just right as of now, and probably honestly just this whole call, we're going to do just questions by chat, just because that's what we did last time and we still didn't get to all questions. So if I start getting people on live, that's probably going to just, reduce the chances of me getting, I might not get to all questions like I did, last time I didn't. But also one other thing, again, if you trickled in late, I mentioned if you emailed your question, copy it, and paste it into the chat here, because I'm just going to be focusing on the chat or the, YouTube live comments. I'm not going to be looking at the emailed questions, just because, as I mentioned, I want to prioritize the live questions. And then I will be having another chat sometime this month that'll be in the evening for those who are probably not here now, but let's maybe watching a recording and will want to attend an evening session. But all right, so let's go ahead and first question is from Kat. All right, so with Graves and thyroid disease, when on the verge of falling ill or getting a sore throat or cold, what herbal remedies or drugs are safe to take? NSAIDs can increase gut permeability, but would acetaminophen and or codeine be safe? Would elderberry, echinacea, and immune modulating herbal remedies to boost their immune system be safe to take? Yeah, so medication, I'm cautious about giving any, because everybody's different, so, I mean, acetaminophen does put a lot of stress on the liver, and everybody's different, so I usually, there's a time and place for the meds, but yeah, so I'm not going to really get into the medication, but, as far as these other remedies, elderberry, echinacea, they are more controversial. I wrote an article a few years ago called on echinacea. So, and I could, this, it gets a little bit complex because there's different, I don't know, some of you might be familiar with like TH1 and TH2. So like what that's the way, like the immune system could shift in different ways. So like with Hashimoto's, for example, typically it's referred to as being a TH1 dominant condition. Graves, a TH2 dominant condition, but that does vary. And the only way to know is by testing what's called cytokines, which used to be, a lot more practitioners used to do that, but now we're realizing there's limitations. But so long story short, echinacea, if someone has Graves, and if it is what's called the TH2 dominant condition, you want to shift them to TH1. Again, that we don't really take that approach. I don't take that approach, and most practitioners don't take that approach anymore. But echinacea shifts, and same thing with elderberry. They do shift people towards that TH1. So I also mentioned this, when I was dealing with Graves, again, this was 2008, 2009, I actually took echinacea. And I did fine, but again, it's not something I commonly recommend. It's, let's put it this way. Nobody has an echinacea deficiency or an elderberry deficiency. There is some concern, I know, with elderberry and COVID-19 about causing like cytokine storm, which is a different story. But if someone has a cold, if you feel yourself getting sick, I would go with I would, definitely, some vitamin C, go with zinc. Go with the nutrients. I wrote a blog post in in April, just, and it was related to COVID-19, just, about immune, just pretty much what this topic talks about. There was 2 articles I wrote. One I wrote on COVID-19 when it first started, hitting the United States. And I spoke a little bit about elderberry and some other herbs, but then the next article, really, again, it wasn't really meant just for elderberry. It's just about improving immune system health overall with that, and really just doing as much as you can without supplementation. But then I did talk about some supplements, but just nutrients, just, again, zinc, vitamin C, vitamin A, vitamin D, selenium. Because again, you can't have an elderberry deficiency or an echinacea deficiency. Not that they can't help to enhance the immune system response. And again, most people probably would do fine with Graves, but there's always exceptions. So, I can't say that everybody with Graves who takes echinacea will be fine. Everybody who takes elderberry will be fine. We could say the same with even nutrients. Some people will take selenium, and you got to be careful. You don't want to overdose with something like selenium, and zinc. If you take too much, that could affect the zinc copper ratio. So yeah, so again, I would mainly focus on diet and lifestyle, making sure you get enough sleep, and just zinc, vitamin C, vitamin D. And you are very welcome, Juliet. All right, so Claudia, so thank you so much for arranging a second meeting with us. The last one was so informative and helpful. Could you please talk a little bit about your thoughts on diet and nutrition and helping to overcome Graves' disease, more specifically dairy and coffee? I've read so many articles on foods which help or worsen Graves' disease. Some say that we should cut out dairy products due to the hormones they contain. Others contradict this and say that due to bone density declining with Graves' disease, it is important to eat milk and other dairy products so as to get calcium for healthier bones. Also, how bad is caffeine, coffee? Thank you again. Greetings from Greece. All right. Yeah, that's why I mean, I like doing evening calls too, but during the day, there's more, more people from different countries at night. I know like people from like Australia, New Zealand, so some countries can't attend the day, but in Europe, it's the opposite. They can't, usually they're not up at like 3 a.m. So, or, neither. Yeah. Anyway, hopefully you're not up at 3 a.m. Nobody that's on this call, but or not intentionally. I know some people wake up and can't. Anyway, so let's get to the question. So I have a habit of rambling a little bit. So, all right. So diet and nutrition and helping to overcome Graves' disease. So there's when talk about Graves, there's or Hashimoto's, there's 4 triggers. So one is food. So there's food, there's stress, or 4 main categories of triggers. Not to say there's no, but food, stress, chemical, and infection. So food is definitely one category. And but that being said, not every food isn't a problem with everybody. So I think everybody should, of course, eat well, eat whole, healthy foods. If you're eating an inflammatory diet, even if food isn't the trigger, like even if food isn't a main trigger, you're still not going to heal. So you eat, regardless, you still want to eat well. But yeah, and some people, of course, gluten we hear a lot about, and there's some people that all they do is avoid gluten alone, and they get great results, feel better, sometimes even maybe get into remission. Others, maybe it's more than gluten. Maybe they have to follow an autoimmune paleo diet for a few months, and then they notice difference. Other people, they follow an autoimmune paleo diet and they don't notice any difference. And in that case, again, it's not that the diet's necessarily hurting you, but it's probably, food is probably not a trigger in that case. So that's where you would need to look elsewhere. So dairy definitely has health benefits. I usually do recommend for my patients to avoid dairy when they're trying to get into remission. Now, again, I have not been 100% dairy free since I've been in remission. So when I was, again, 2000, I was diagnosed late 2008. So 2008 into 2009, I was avoiding dairy when I was dealing with Graves, but it's not like I've been dairy free since then. But some practitioners will say that too. They'll say, not only do you want to avoid gluten and dairy completely while trying to restore your health, but even after you're in remission. And so again, knock on wood, I've been doing fine without, with, again, minimal dairy. It's not like I'm having dairy all the time, and it's usually like cheese. It's not like I'm not drinking. Growing up, I drank plenty of cow's milk, but yeah. So, yeah. So again, I do recommend avoiding dairy. And as far as the bone density, just remember why people with Graves, why it's a concern, the bone density is because of the high thyroid hormone levels. It's not because of the dairy. So you could be consuming plenty of dairy or extra dairy with hyperthyroidism, but that's not really going to offset. That's not going to help much with the bone density because it's not due to calcium deficiency. You need to get those thyroid hormone levels to normal levels. So you need to, whether it's through methimazole, anti-thyroid medication, or I know overseas sometimes it's carbimazole, which converts it to methimazole, or bugleweed. But either way, so you need to prioritize getting thyroid hormone levels. back to, yeah. So, I mean, dairy, it is a source of calcium, which is, I'm not saying it doesn't play any role with bone density, but in that situation, yeah, that's, you know, that's really not going to have much of an impact on, again, you just need to offset the thyroid hormone levels, the high thyroid hormone levels. And then coffee. So this, yeah, so coffee, I will say, Sarah, for those who are not familiar with Sarah Balanson, she's done a lot of research on autoimmune paleo diet, and she has a few books. One is the Paleo Approach, and then I think Paleo Approach Cookbook. She has different stages of reintroduction. So initially, I think it is a good idea to try to avoid coffee, caffeine. Again, some people find that more difficult to avoid than gluten, but what she recommends now, like a few years ago, she has 4 different stages of reintroduction, I'm sorry, caffeine, coffee used to be in the 3rd stage. Now it's in the 1st stage. So with her research, she's shown that you could, and also not just research, experience with people she's worked with too, but so now it's in the 1st stage of the reintroduction, small amounts, not like drinking, you know, like a few cups every day. But it really does depend on the person. That's why you want to reintroduce foods slowly, including coffee. So, you know, if you eliminate it, eventually reintroduce it sooner than later, you know, listen to how your body feels. All right. So Jan, what eye exercises do you recommend for thyroid eye disease? Yeah, I personally, I leave that, like things like that to, I mean, most people when they have, you know, severe enough thyroid eye disease, like moderate to severe thyroid eye disease, they're usually seeing like an ophthalmologist. So again, I don't work that closely with, like I work closely when it comes to diet, nutrition, finding triggers, finding underlying causes. You know, the eye exercises may help, but again, it's not getting to the underlying cause. The same thing with Tepeza. If someone wants Tepeza, you know, they can't, you know, even if I think it's a good idea, it's not something I could recommend. Now, eye exercise is a little bit different, but again, I think that's also better in person. You know, most of my patients are remote. So just like working one-on-one with like an ophthalmologist. But yeah, so let me just, okay. All right, so Jen, I've been in remission for over 1.5 years, but every so often I'll get ongoing heart palpitations. So diet is clean, low sugar, no caffeine. I exercise every second day. Stress management is good. What I find helpful is 4 full droppers of Golden Seal twice per day. After the 3rd day or so, they are completely gone. CBD oil helps me to sleep through them, but not get rid of them. What are your thoughts on Golden Seal for heart palpitations? Interesting. I have not heard for, you know, Golden Seal when it comes to heart palpitations. Usually it's more commonly used as like an antimicrobial treatment. Yeah, but I'm not usually, like I would think when think about herbs, I would think of, I mean, motherwort, which, you know, a lot of people take when they are not in remission for Graves, but you could also take it for cardiovascular support, or hawthorn. Actually, I take every now and then, I'll take some hawthorn. I have like a bottle of hawthorn in my home, and, you know, just for cardiovascular support. So I'm not sure. Yeah, with Golden Seal, so pretty much 4 full droppers twice a day, and then after the 3rd day, I mean, I guess it's okay. I wouldn't be, like I said, it is an antimicrobial, so I would, you know, hopefully you're just every now and then. I mean, you say every so often, so hopefully, so it's not something that I would, you know, take continuously, which you're not. But yeah, as I mentioned, I've not heard about Golden Seal for heart palpitations. But you know, the wonderful thing about herbs is they do have multiple benefits. Even, I mean, bugleweed is one of those that mainly is just for like lowering thyroid hormone levels, but I'm sure there's other benefits we don't know about. Even motherwort, speak of antimicrobials, motherwort does have some antimicrobial properties too. So it's not just for cardiovascular. Okay, and Eugenia, thank you so much for hosting. I've been able to manage my hyperthyroidism Graves to a level where I generally feel good without medication. With the help of a variety of treatments, I have, however, quite a feeling of pressure, zoom in my head, kind of always. I was wondering if it could be a symptom that I'm unaware of. Thank you. Yeah, so So let's see, you've been able to manage your hyperthyroidism to a level where I feel very good without medication. So, I mean, it could, so I guess this is where it gets a little bit challenging through Zoom, is that, it's again, like, not knowing what are the thyroid hormone levels within range, but on the higher side, or are they a little bit elevated? I know you said you're managing them without medication, so maybe taking bugleweed or L-carnitine, but I mean, it could be related to, to the I can't say it's a common symptom of the hyperthyroidism, but there also are uncommon symptoms. Could also be, a lot of strange symptoms, infections, like, hidden infections, or maybe not hidden, you just need to test for them. But like stealth infections, like viruses, like Epstein-Barr, sometimes, many of you know about my experience with Lyme disease in 2018. So not saying that that's what you have, but again, so that's where, again, I can't say it's a common symptom, but that's where we need to probably look at more of a health history, look at your labs, your recent labs, as well as, do like a health history. Again, not necessarily me. I mean, it could be me, but there's, of course, other doctors too, just to see what other imbalances. Is it maybe the hyperthyroidism is control and has nothing to do with the hyperthyroidism, but there's something else, going on, like a infection, or, just, again, I don't, even with adrenal problems, like, it's usually we're not getting like a pressure, like you said, like a zoom in your head. But yeah, so that something like that, I definitely, even though you're managing the hyperthyroidism, but you want to get to the root cause regardless. Even if you weren't experiencing those symptoms, you don't want to just rely on taking bugleweed, L-carnitine on a permanent basis. You want to try whenever you can to address the cause. So, all right. So Juliet, my nodules have been shrinking, but would love to have them shrink even further. Any suggestions? So yeah, I've written, again, I'm coming out with an article this Thursday, or blog post this Thursday, on toxic multinodular goiter, which even if you don't have that, it does talk about nodules, like what reasons why people have nodules. So estrogen metabolism issues and insulin resistance, those are two big factors when it comes to nodules. Also sometimes iodine deficiency, which of course is very controversial in the world of thyroid health. But yeah, so those are some things I would be looking into, just looking into estrogen metabolism. A good test is the Dutch test, that looks at, because a lot of people look at estrogen levels, which is okay, but it's also sometimes beneficial to look at the estrogen metabolism ratios, which is what the urinary testing has the ability to do. Blood testing can't do that. And I just wrote, so that I have another YouTube channel. If you go into YouTube, which some people are under YouTube right now, on YouTube Live, but I have a channel, Understand Your Test. So if you just search for that in YouTube, also understandyourtest.com, you could also visit that's a website associated with that. But I just released an article, or I'm sorry, I released a new video last week on speaking about estrogen metabolism. So you could learn about that, and talk about the Dutch test and ways to deal with estrogen metabolism. But again, insulin resistance in the research has shown to promote the growth of nodules. Again, sometimes iodine deficiency, but also, so check out the estrogen metabolism video. Also, the article I'm about to release on Thursday, and then I've written some articles on nodules that are on my website. Just nodules in general, not, again, this Thursday it's focusing on toxic multinodular goiter, but there's an article, if you visit my website, shrinking thyroid nodules, I forget what keyword, but if you do, just type in a few different keywords, and again, I also speak about it. And then there's also an article that I wrote on insulin resistance and thyroid nodules. So again, you might have to type in insulin resistance, thyroid nodules on my website. If there's any problems finding this article, just email us, info@Natural Endocrine Solutions, and just say I can't find the article, and we'll find it. We'll pull it up for you and send it to you. All right, Eugenia, P.S. I read your book about 2 years ago when I was diagnosed. Great help. All right, thank you so much. Okay, and then Maya. So hi, Dr. Osansky. Thank you so much. A quick question. I'm feeling a lot better after 2 months of herbs and L-carnitine. How do I safely wean myself off of the supplements and herbs? I did not test positive for TRAB antibodies, which, those are TSH receptor antibodies, which are associated with Graves. So my doctor ruled out Graves. And I talk about a little bit about that on Thursday, as far as different, I've spoken about it in greater detail, diagnosing Graves. So antibodies are one way, and then I assume you're not having eye symptoms, so thyroid eye disease also, because there is a chance of false negative antibodies when it comes to Graves. But anyway, as far as safely weaning off the supplements and herbs, so I mean, when I was dealing with Graves, I went by testing, so I looked at, when it came to like bugleweed, for example, that I did rely on the thyroid panel. So L-carnitine, you're probably using that for for symptom management to help with the thyroid hormone levels as well. But so when thyroid hormone levels were looking good, when TSH was, well above 1, when both free T3, free T4 were well within the range, and again, usually TSH is not going to increase until free T3 and free T4 are both within the range. So free T3, free T4 are looking good, and TSH is still low. Keep in mind, it could take a while for TSH to increase. And usually at that time, you wouldn't want to wean. I mean, even endocrinologists, when someone's on antithyroid medication, such as methimazole, they usually won't start decreasing the dosage until someone's TSH is looking good. So same thing with the bugleweed. And then as far as everything else, like, I don't know what else you're taking, but you said 2 months of herbs and L-carnitine. I mean, so like I did testing for adrenals, for example, and, and I did a retest. Now, again, I know not everybody has the, money to test and retest. Some people don't even get an initial test, but my adrenals were in pretty bad shape. So I wanted to do a retest. And then based on the retest, that's how I decided to wean off, at least some of the herbs with adrenals. You don't need necessarily testing for everything, or at least not specially testing. Like if you're taking, let's say gut healing herbs. Now, again, this probably applies more for Graves. So one thing with Graves I do look at is not only thyroid panel, TSH, free T3, free T4, but antibodies too. So we ideally want to see antibodies normal. If someone doesn't have antibodies associated with Graves, so if let's say you don't have Graves disease, then, you go with other, obviously other numbers, like, again, just thyroid panel, vitamin D. Obviously, if you're deficient in vitamin D and taking vitamin D, that you definitely would want to eventually do a retest. And, some people need to take certain supplements regularly. Like I do need to take vitamin D regularly. Probably some of it is because I don't get enough sun exposure, but I think even if I got regular sun exposure, I probably still would need to take some. Just there's other factors why people need to take not everybody, so everybody's different, but the only way to know really is by testing. With herbs, obviously there's no, like I mentioned earlier, you can't be deficient. I mentioned like when someone was brought up echinacea and elderberry, and that's the same with pretty much every herb. I'll also say 2 months of herbs, not a whole lot. Like for Graves, it does take a good amount of time. If you have something else going on, like subacute thyroiditis, I mean, that a lot of times, I mean, that's usually viral, could be bacterial, but in that case, someone's thyroid hormone levels might normalize relatively quickly. Sometimes they'll become hypo. Well, usually it's temporary. Sometimes it's not. But yeah, so really, I look at testing, and also, that's when work with someone, like through regular consultations, and also not just testing, but seeing how they feel as well. Because again, some things you can't just rely on testing, and some things it's a little bit of an experiment where you might have someone where, in my case, I might say, okay, let's, everything's looking really good, symptoms are good, blood tests are looking good. Maybe they did some other testing and those look good, or maybe they did other testing and they didn't retest, so we don't know. But it's like, all right, let's just, have you slowly wean off. Again, I can't tell you specifically like to what to do, but in the patient's case, I'll say, well, let's, if you're taking this specific product, this specific herb, like 1 capsule twice per day, or if it's liquid, 1 teaspoon twice per day, let's, reduce it to 1. With bugleweed, I was taking a teaspoon twice per day. of Medeor bugleweed. And, you know, it's not like I just stopped that when the thyroid panel was normal. I reduced it to half a teaspoon twice per day. And then eventually, after doing another thyroid panel and that looked good, I took a half teaspoon once per day and then, you know, weaned off. All right, so this, someone sends a private message. I won't reveal his name, but if someone sends a private message, I'm still gonna, without revealing the person's name, I'll say the question, just, but I'm not sure I understand. So how does one, or did you put weight onto the shoulders and back? So you might, I'm not really sure. So maybe if you could elaborate. So just, all right, yeah, if you could, like I said, if you could elaborate with that. All right, so Karen, I was diagnosed with Graves in 2001 and chose Tapazole for treatment. I finally stopped it 2 years ago, encouraged by acupuncturists. My TSH in February was 1.042, TPO antibodies greater than 1300. I've been told I will likely head towards Hashimoto's based on my TPO antibodies. Also in 2014, I had a toxic and essential elements hair test done. My iodine level was 0.76. I'm not sure if I should try the iodine that you recommend. I'm currently reading your book. Yeah, so again, iodine, so I had a really good experience with iodine when I was dealing with Graves, but over the years, just like a lot of practitioners, I've become more cautious. So usually I don't, you know, it's not something I focus on other things with my patients. I mean, if someone comes to see me and they want to talk about iodine, of course we'll talk with it, but a lot of people, it's the opposite. They don't want to hear about iodine. Their endocrinologists have, you know, discouraged them from trying iodine. So, you know, with any nutrient, you want to eventually correct it. You know, like if you have a deficiency, you want to correct the deficiency, but not everybody does well with iodine. And there's reasons for that. Usually it's because you know, they're low in antioxidants. You know, so that's where, you know, like why a lot of practitioners recommend taking selenium and doing things to increase glutathione, because when you take iodine, there is oxidative stress that's formed in the production of thyroid hormone. But I will say I never relied on hair testing for iodine. I do hair testing in my practice, but I don't look like like iron is another one. Like iron, I would never rely on hair testing for, you know, like on a, you know, to look at iron. I would recommend doing a full iron panel in the blood, you know, not just iron, but iron saturation and ferritin and TIBC. But yeah, so if someone is going to test for iodine, I would say do a urinary test. Hakala Labs, H as in Harry, Hakala, Hakala Labs. They used to be in Colorado. I think they're now in Wyoming, but you know, they have iodine testing in the urine. But like I said, it's not something, I mean, you know, iodine can potentially help with symptom management. It's not, you know, just, which for some people sounds strange because it helps with increased production of thyroid hormone, but when taken like higher doses, it could have the opposite effect. But again, there are some people where their antibodies will increase. Some people, if they have thyroid eye disease, that will worsen. So like I said, I'm very conservative now when it comes to iodine, and that's not like usually, I mean, it depends on the person, but usually I'm looking at finding triggers, underlying imbalances. We could argue that iodine can potentially be one of those underlying imbalances, but usually it's not a priority. So, but like I said, if someone actually wants to, like if a patient of mine brings it up and wants to talk about it and wants to do testing and safely, I mean, again, safely supplement with iodine, but you know, it's, if you've never taken it before, you don't know, even if you're doing the right things again. So that's why usually I'm looking to improve the person's immune system health, improve their antioxidant status. And then, you know, later on, that's something we could address. But yeah, so like I said, I wouldn't rely on hair testing. And then, yeah, I just would be cautious about, you know, because again, usually there's other things going on with especially with Graves. You got to find the triggers, underlying imbalances, heal the gut. Okay, and here's another, okay, another private message. Do you know anything on how to minimize or heal latent Okay, I assume this is Epstein-Barr. You know, so Epstein-Barr, once it's in your body, at least now, maybe things will change in the future and we'll find a different one. But there's, yeah, most people have Epstein-Barr. 90% of people have Epstein-Barr, and it could definitely be a factor with you know, with the Graves and Hashimoto's. So just because 90% of people have Epstein-Barr doesn't mean that it causes problems in everybody. And I did write a blog post last year, 2019. I've written a few blog posts, on viruses and a couple on Epstein-Barr, but a recent one last year that goes into detail. But I mean, remember, it's more of an immune system problem than a virus problem. So same thing when I was dealing with Lyme disease, you know, diagnosed with chronic Lyme disease in 2018. And before that, I was terrified of Lyme, you know, of getting, you know, of getting Lyme, but even if a patient came into my practice with chronic Lyme, I would make it clear that you know, I'm not a Lyme specialist, that, you know, I could help you with your Graves or Hashimoto's, or other condition, you know, thyroid, autoimmune thyroid condition. But, I don't know what's going on, but I don't know if someone's drawing on my PowerPoint or because I'm not doing that. I'm sorry, I'm seeing like lines. I don't know if it's just me, but seeing something on my PowerPoint. But anyway, whether it's a viral or, again, something like Lyme or co-infection, you know, that I will sometimes put someone on an antiviral protocol either through herbs or homeopathy, you know, but you need to address it. You need to improve other areas of the person's immune system's health. So if someone has, you know, reactivated Epstein-Barr virus and all they do is take herbs or homeopathy, I mean, it may help, but it's not going to, I mean, chances are you're going to need to do other things. You need to have a healthy gut. If there's anything else dragging down the immune system, whether it's weak adrenals, toxic molds. And that goes for any viral infection. I mean, even, you know, COVID-19, it's still important, you know, as far as, I mean, different scenario, but still you want to, you know, do as much as you can to improve immune system health. Okay. Do you have any thoughts on Anthony Williams and his celery juice theory? I don't know about his celery. I know I've read, yeah, so I won't get too much into detail what Anthony Williams, but I mean, I add celery. You know, I know he talks about celery juice and his, you know, I know he has a whole book, I think, on celery juice now. But so for those who don't know, Anthony William, he's you know, medical medium, and he has like a book, Thyroid Healing, and yeah, so I've had a number of patients bring him up, and I mean, it's definitely not going to hurt, you know, I don't know if celery juice is that, and I'm pretty sure that's not all. I mean, I know that's not all he recommends, but I do add celery to my smoothies. I don't, you know, I don't do juicing, but I add the celery to my smoothies. And so, yeah, definitely think celery is beneficial, but yeah, and I know he talks a lot about Epstein-Barr as well. Pretty much thinks that Epstein-Barr is the cause of most thyroid conditions. All right, so like I said, I'm going to try to spread the wealth a little bit. So I know some people having repeat questions, but I want to make sure to get to as many people as I can, because I don't think I'll be able to get to all questions. Okay, so almost said the person's name, but the person, I don't know. Sometimes people send it privately by accident, but sometimes so. So anyway, I started saying the person's name, but then again, I use Zoom, but not enough where sometimes when they see, yeah, I'm used to most people not sending it private, the chat. So, so anyway, this person was diagnosed with Graves' disease a year ago. I'm currently on Tyrosol and propranolol. My thyroid hormone levels have improved. My TRAB, again, the antibodies, TSH receptor antibodies, has improved, but my TSH is still almost non-existent. Exophthalmia. So again, I'm having some thyroid eye disease symptoms that developed for the past 2 months quite aggressively. I am from Romania. I don't know any natural doctor to talk to. Where should I start? Yeah, so again, I would start, even though it's not, you know, it's not the answer to everybody's solution, but I would still start with diet and lifestyle. You know, try to do as much, you know, you're taking the medications, and, you know, you're having some thyroid eye disease symptoms. So definitely, even though food's not a trigger in everybody, I still would start cleaning up your diet, stress management, trying to get sufficient sleep, doing things to reduce your toxic load, just because we live in a toxic world. And, and then besides that, that's where, I mean, sometimes that's enough, but if not, that's when more detective work is needed to find triggers. Like I mentioned, there's food, there's stress, there's chemical, there's infection. And so I mean, a lot of practitioners, including myself, do remote calls. That's only going to increase based on everything going on now. Just like a lot more practitioners, I assume, are using Zoom and other things to work remotely. So even if you don't have anybody locally, there's others that you can consult with remotely. But again, if you haven't focused on diet, lifestyle, things that, I mean, that, because you're going to need to do that regardless. So you could start there. And again, some people notice great results just with that alone, but a lot of people die. And I wrote an again, I think it was 2019, talking about a blog post, again, that diet alone isn't, usually it's not the solution. Sometimes it is, but that being said, it still could be a trigger, maybe the trigger. But either way, that's if you're not eating a whole healthy food diet, avoiding common allergens such as gluten, dairy, corn, that's a place I would start, blocking out time for stress management. And then, yeah, you might need to work remotely with a practitioner if there's nobody locally to work for. All right, let me just, I said after like a half hour, I would, oh wow, we got a good number of YouTube. I said I would check some YouTube, see the YouTube chat. Let me answer a few questions from YouTube Live here. Okay, so Sharon, can heavy cardio, such as a Peloton bike, cause thyroid levels to get high? Thank you. I mean, thyroid exercise, you do want to be, I mean, first of all, I mean, you want to be careful just in general. When I say you, just people in general, not to overtrain, because that definitely could be problematic. Then in addition, you don't want to exercise before doing a thyroid panel, because if you exercise, especially if you're doing like heavy cardio in the morning, and then a few hours later, or especially right after, but even a few hours later, you go to the lab and get blood drawn, then that definitely can affect thyroid hormone levels. I mean, usually it's not going to affect, like if you talk about free T3, free T4, usually it's not like, it won't induce hyperthyroidism. Like if someone, just as normal thyroid hormone levels, usually not going to like present as hyperthyroidism, but if someone already has a pre-existing thyroid condition, it definitely could throw off the numbers, the heavy cardio. But like I said, also, when someone says heavy cardio, I do get concerned about, are you overtraining, which definitely, that could impact the immune system for someone with Graves' disease, for example. All right, so I have thyroid eye disease on my left eye. Problem, I developed fat under my eyes and above. Is it going to disappear with time? Because of it, my eyes are uneven now. Yeah, it depends on the severity. Again, I mentioned earlier, I had the slides up on thyroid eye disease. So I don't know if you caught that, but it, like mild to moderate thyroid eye disease, reversing that is definitely possible. Again, I won't say in everybody. Some people even, everybody's different, but the more severe it is, the less likely it is to respond to natural treatment. There's also Tepeza. Now for that, I know Tepeza, like for, again, bulging eyes, and then, double vision. But yeah, like what you're describing, I'm not 100% sure. So, but yeah, I mean, I'm going to, so if you're not having other symptoms like, severe bulging or, moderate to severe bulging, double vision, and you're looking to, give a natural treatment approach a try, then obviously just, just with anything, you're going to want to monitor it, see, if if that improves, and, and then, after a few months, if that you're not seeing that improve, I mean, it's not going to, of course, it's not going to hurt now to go to an ophthalmologist, get an opinion, but usually, when it comes to thyroid eye disease, again, now they might recommend it to PISA. In the past, it would be pretty much thyroid surgery, eye surgery, which again, they might not do just for that. Depends on, just overall, your condition. But thyroid eye disease, thyroid surgery, thyroid eye surgery sometimes is necessary, but I've heard some nightmare stories too of people needing more than one surgery. But yeah, so the honest answer is it might resolve on its own, but it might not. But you should start, as long as you're, as far as if it's just going to like spontaneously resolve just without doing anything. I mean, even thyroid eye disease, sometimes it clears, like, you have the active phase of thyroid eye disease. And if it's very mild, people who are just taking methimazole and not following the natural treatment protocol, sometimes it'll resolve. So I'm not saying it like you always need a natural protocol, but, of course I'm going to be biased because that's what I do, try to get to the cause of the, the autoimmune component. And because again, there's also the opposite concern that it might get worse. So, that you might have other problems, concerning the eyes. All right, so Rebecca, deciding to go the natural route for 2 years to battle hyperthyroidism Graves. At what point do you take meds if the thyroid numbers are going up and down? Yeah, so again, I took bugleweed, but a lot of my patients take antithyroid medication. So with bugleweed, I took the bugleweed and it worked, worked great, but that's not the case with everybody. Some people, it doesn't work. So if I took bugleweed and if it wasn't impacting my thyroid hormone levels, if the thyroid hormone levels continue to stay high, I would have considered taking, let's say, methimazole, even though I wouldn't have been thrilled with it. But again, everything's risk versus benefits. And, I know you mentioned if thyroid numbers are going up and down, which, so if you're not taking medication, I'm not sure what out, like if you're doing anything else, like taking bugleweed and like just weaning off. And I mean, again, it all comes down to addressing the cause of the problem. So even with methimazole, like if bugleweed didn't work in my case and if I switched to methimazole, I'd still be, following a natural treatment protocol to address the cause of the problem. So same thing, with you, Rebecca, so you've been dealing with it for 2 years, and I don't know what you've done, not, I'm not, like you said, deciding to go the natural route for 2 years. So I'm not sure if you're thinking about it now, but, and then also thinking, well, maybe, do I need meds? But, but yeah, I mean, medication is you want to be safe. I mean, high thyroid hormone levels, not only affect the cardiovascular system, elevated heart rate could increase risk for things like arrhythmias. But also we mentioned bone density earlier. So, you just got to be careful if your numbers are going like up and down, like just randomly, like you're hyper and, like one for a few months and then hypo, then, I wonder if it might not be hashitoxicosis, for example, in that case. But I'd hate for like you to be on methimazole, which has antithyroid properties, and then if you're going up and down when you're down and you're on methimazole, like if the thyroid hormone levels decrease on their own, and then you're on methimazole, that can make you hypo. Like someone like hashitoxicosis, there are some people that have put on antithyroid medication, but a lot of times that's just transient, the hyperthyroidism. So they might be hyper maybe for a few days, maybe for a few weeks, sometimes a few months, but then they might be hypo. They might have periods of hypothyroidism, and then if they're taking methimazole, they're going to be like super hypo. Let's see. So Willie from Tampa, my hyper-T is very well controlled, but sometimes I have anxiety attacks accompanied by a very annoying cough that lasts for about 10 minutes. Can that be a symptom? How can I control it? Yeah, I mean, the low, well, you said it's very low controlled, but again, the anxiety attacks, and sometimes, I mean, most people don't have like an annoying cough, but it can, that can be a factor as well, but especially the anxiety attacks, so you're mentioning it's well controlled. So as I guess I've been mentioning, it's so I mean, first of all, it's when you say well controlled, it's still, like what, if you're a patient, I want to, of course, see the numbers and see, like what everything looks like. I'd like to see not just a thyroid panel, but just like most doctors, I want to do a comprehensive metabolic panel. I'd want to do, CBC with differential. I mean, pretty much I would want to do, just a lot of, not a lot, but I want to do some blood. I mean, it depends on the person, but some would consider it a lot of blood work, like doing CBC, a comprehensive metabolic panel, of course, thyroid panel, and vitamin D, and maybe B12, for example, and CRP. So I do recommend a good amount of blood tests for those who are able to get it. But so again, there could be other factors as well, like adrenals, so that's why I recommend adrenal testing for most people. So it's all about what, so when you say it's well controlled or someone else says they're managing symptoms. So again, of course, we want to try to do more than just take antithyroid medication or take bugleweed, but do other. So again, if you're still having anxiety attacks and the annoying cough, again, if you're taking the antithyroid medication, if it is really under control, or if you're taking bugleweed and it's very, under control, thyroid hormone levels look good, TSH is looking good, then, maybe we could say it's not due to the thyroid. Maybe it is due, but just remember, again, I'm not sure if yours is Graves or, something else like toxic multinodular goiter, but again, Graves is an immune system condition more than a thyroid condition. So, so again, it's great that it's, that it's being managed. That's important to be safe. But as I've been saying, we want to address other underlying, find and remove triggers, address underlying imbalances. Okay, so, okay, Alana, will adrenaline test, will this be effective during the lockdown period when there are no stressors at the moment, really, and you feel calm most of the time? Yeah. I guess it depends. I mean, yeah, that not everybody feels that way. Some people, it's the opposite, where they're, so adrenal testing, I mean, cortisol responds to stress, whether you get it done in the blood, whether you get it done, through the saliva. It, if you get, let's say, a blood test and you get stressed out before the blood test, or same thing with the saliva test, or there's also dried urine testing, again, it could definitely spike up. Now, the opposite, you mentioned the opposite. If you're like, let's say, if you're not stressed out and you're calm, it depends. If someone, like when I was dealing with when I was dealing with Graves and I had my adrenals tested, everything was low, and, so let's say at that time, if I, 2 months, just again, this is just going back, like when I was diagnosed, if 2 years before I was diagnosed, I'm sorry, 2 months before I was diagnosed with Graves, if there was a lockdown and then I got my adrenal testing, in my case, it probably would look similar because everything was low. It was like almost, a so-called adrenal fatigue state. So everything probably still would be low because just being in a calm state isn't going to restore the health of the adrenals. If someone, on the other hand, has high cortisol levels, that's caused by let's say work every day, their work, just a high stress environment. And then, like due to the lockdown, things are calmer and maybe the cortisol in that case isn't as high. Things don't look as bad. So yeah, I mean, without question, that could, in that situation could be a factor. Again, DHEA doesn't respond like cortisol, meaning if like your DHEA is low, just like relaxing. I mean, there's always exceptions, but it's so you could still like look at DHEA. But as far as cortisol, I mean, you can still look at it. Like I said, it depends on what pattern. There's no way of knowing what pattern you had before the lockdown if you didn't have a saliva test. So there's like no way of comparing. But I will say that, like having no stressors, it depends on the adrenal situation. Like I said, in my case, or someone who has a similar situation as I did, where everything's low, just relaxing, not that it won't help at all, but it's usually not going to normalize the adrenal test. If the cortisol levels are high, it might, it might, or at least, probably will lower it where it doesn't look as bad. Okay, so Violet, what natural treatment can I use? I have hyperthyroidism, Graves, and then my doctor wants to use iodine to kill the thyroid. So yeah, as I mentioned, I mean, very, very general question, but, I mentioned earlier to someone, like, start with diet, lifestyle, even though a lot of times that's not, the whole, like, that's not the entire solution, but still a good starting point is to clean up your diet, do things like block out time for stress management, try to get sufficient sleep, do things to reduce your exposure to environmental toxins, and even your elimination to environmental toxins, like increase your body's elimination of the environmental toxins inside. And then, you know, and then also you might want to take it a step further and do some testing. I usually recommend blood testing, adrenal testing. In my practice, I do hair mineral analysis. Sometimes I'll do a comprehensive stool panel or organic acids test. It really depends on the person. Usually I'm more conservative with the testing, but it depends on the person's presentation, on their symptoms, on their health history, just what they've already done as far as testing goes. But of course, the goal should be to try to do everything you can to avoid, the radioactive iodine. All right, so Elvira, can I stay on block and replace therapy forever? I pretty much feel okay and would continue this way, but Endo is trying to get me off of it, saying it might bring bad side effects. She's on 4. So block and replace is when you're on carbimazole, and so the carbimazole is blocking and then replacing it with thyroid hormones. They don't do this as common in the United States, and this person, I'm pretty sure, is not in the United States because she's taking carbimazole, which usually they don't recommend in the United States. So and like, yeah, block and replace, rarely done in the United States. I mean, if yeah, as far as can you stay on it forever? I mean, 40 milligrams of carbimazole is, I mean, it's a good amount of antithyroid medication. That's like, some people are on low dose. I'm just going to take a quick sip of water. Some people do remain on low dose antithyroid medication. Again, not block and replace, although it can also be, I guess, block and replace, just with a lower dose. But again, if someone's on a maintenance dose, like 5 milligrams of antithyroid medication, not as big of a concern. But yeah, I know I wouldn't want to be on 40 milligrams, and then again, 100 probably you meant micrograms of levothyroxine. Not as big of a concern because it's a replacement, but it's a replacement because you're using the, yeah. So I'd be curious to see. And again, obviously, this would be your doctor. Like, if you're going to be on it longer term, to be on a lower dose of carbimazole, which would necessitate a lower dose of levothyroxine, like 20 and 50. Maybe that was already, tried, 20 milligrams of carbimazole. But, and even that, I wouldn't be comfortable, I don't think, like, I'm obviously the ideal goal is not to be on any antithyroid medication at all. But again, 5 milligrams arguably is a, real low dose, but anything like, like 20 milligrams or above. But even the 5 milligrams, I'd want to try to address the cause of the problem. So yeah, I mean, you might be able to be on it regularly if your liver enzymes look okay with retesting, and but again, yeah, it's just, to me, it's, yeah, I would. And plus, if you have Graves, I don't know if you have Graves disease, but again, remember, it's autoimmune, so there's risk of developing other autoimmune conditions in the future. So yeah, I would say to try to address the cause of the problem, which obviously they're not going to be doing. They're just trying to keep you on that, and then eventually hope that you go into remission. And then if not, they would, recommend the radioactive iodine or thyroid surgery. All right, so I'm gonna go back to the Zoom, and again, I could chat for about another 20 minutes. And yeah, I'm sorry that I won't get to. I thought I might be able to get to. When we first started, we had, like not a whole lot of people on, and now we're up to, we're in the 40s, 42, and some people on YouTube Live as well. But anyway, yeah, definitely, I'm pretty sure I won't get to all questions just because there's a lot of questions here. So like I said, I'm gonna try to get to everybody at least once, which that might not happen. But okay, so Kathleen, I have Graves antibodies, but I'm told I have a euthyroid. so normal thyroid, so meaning it's in a normal blood range, but you have the Graves, all the Graves symptoms. All right, so you have like subclinical Graves disease, Kathleen, it sounds like. So, or at least subclinical with regards to the blood. So you might have low TSH, which is common, I'm not sure, but low TSH, and then normal T3, T4, I'm not sure, but a lot of people with subclinical Graves, I mean, not a lot of people have subclinical Graves to begin with, but subclinical Graves, oftentimes they'll have low TSH, elevated, TSI, which are thyroid stimulating immunoglobulins, and then free T3, free T4 will be normal. And some people are asymptomatic, but some people like you, it sounds like you do have all the Graves' disease symptoms. So again, with the if you're seeing an endocrinologist, they're probably not going to, they're probably not going to do much if your TSH is depressed, they might still say take antithyroid medication. If TSH is looking good, they're not, because again, they're not doing anything for immune system. So just again, remember, Graves is autoimmune. So we want to do things to address the immune system component. In your case, again, I don't know what the TSH looks like, but even if, like, again, if someone came to me, subclinical Graves, TSH was depressed, thyroid hormone levels normal, and they were having some symptoms, I mean, maybe I would say, well, why don't you take some bugleweed temporarily while addressing the cause of the problem, while finding and removing triggers. So that's an option also to consider as far as like taking bugleweed. Again, I can't tell you specifically to take it, but if TSH was depressed, but free T3, free T4, thyroid hormone levels were normal, then in that situation, I might give someone, a low amount of bugleweed, and then of course do things to improve immune system health. All right, so Judy, why am I endlessly hungry? I'm not sure, Judy. So I know again, thyroid. I think thyroid. So anyway, let me bring up a few things. So, and again, something maybe to talk about more one-on-one, but so hyperthyroidism, elevated that, like when I dealt with Graves, that I definitely had a voracious appetite, so and it took a while, even when my thyroid hormone levels were imbalanced, it did, like the weight, I lost a lot of weight. I know not everybody with Graves loses weight, but I lost a lot of weight. And it's, so two of the symptoms that took a while to get rid of was the weight loss, and to gain back a good amount of weight, and then also the appetite. So I was endlessly hungry too. So that is one thing, one factor also. And then, blood sugar as well, could be, like it's, typically more closely associated with low blood sugar, but some cases high blood sugar as well. So you want to, balance adrenals, balance blood sugar, of course, balance thyroid hormone levels. So those, also, it could be nutrient deficiency due to, like, if someone has a condition such as, some type of malabsorption, like SIBO, small intestinal bacterial overgrowth, that could be a factor that, just, because again, you might not be absorbing nutrients. So, even if you're eating plenty of food, and even if someone's hyperthyroidism is under control, let's say, just not getting the nutrients that they need due to absorption problems. So that's, so anyway, those are some reasons. Okay, and then, all right, I'm not sure if I'm probably not going to pronounce your name right. Nawoki, what are natural remedies you advise? I really do not want surgery as an option. Have had mine for about 24 years. So yeah, like I said, there's not one protocol for everyone. That's, like I said, I did the diet lifestyle factors, which I recommend to everybody, cleaning up your diet, just maybe start off, not autoimmune paleo doesn't agree with everybody, but it's a starting point for, especially those with Graves. If someone doesn't have, Graves, let's say if they have hyperthyroidism, but it's not autoimmune, then maybe like a paleo diet. If someone's vegan, vegetarian, there's also like Stephen Gundry, like his plant paradox diet. But again, I don't agree with everything on that. Like dairy, he does recommend. But the main thing these all have in common, all these diets, is whole, healthy foods, a good amount of vegetables. Should be plant-based. Even if you're paleo or autoimmune paleo, you still want it to be mostly plant-based. And yeah, so so again, diet, lifestyle, stress management, getting enough sleep, and then I mentioned reducing toxic load, and then again doing the appropriate testing to find, remove triggers, correcting underlying imbalances. Definitely, check out my website. I have a lot of information on my website, a lot of articles. Of course, everything's free. As far as articles and blog posts, and but yeah, just like I said, it's not just one protocol for everybody. Everybody has different triggers. Everybody has different underlying imbalances. All right, so Deborah, I've been dealing with Graves for 5+ years, and I am increasing in symptoms. I did a thyroid panel test last week. My doctor suggested thyroid removal or radioactive iodine. Which is safer, and do you feel methimazole should be attempted before? If I do a thyroid removal, is it possible to have another autoimmune disease? Okay, so Deborah has been dealing with Graves for 5 years, and her symptoms are getting worse, and she did a thyroid panel. So pretty much, so our doctor, not surprisingly, recommended either a thyroidectomy, getting the thyroid removed, or radioactive iodine. I mean, yeah, as far as which is safer, I mean, they both have risks, of course, and it's a tough decision. I mean, I think if I had to choose between the two, I think I would choose surgery. Just and again, not that I'd be thrilled about the surgery, but just the thought of taking the radioactive iodine, and just I know they say it's completely safe, but it's yeah, just but there's a risk with surgery too. It's not like surgery. Obviously, you want to go to a surgeon with a lot of experience removing thyroid glands. Um, so but that's probably what I would go more with, the surgery than the radioactive iodine. I mean, just radioactive iodine, you could I mean, the quarantine people, maybe not as much in this here, but in other countries, like for 4 days, and I mean, can't get pregnant, or attempt to get pregnant for a cycling woman for like at least 6 months, maybe a year. I mean, so again, if it was completely harmless, like they wouldn't have all these restrictions with radioactive iodine. Again, so surgery, yeah, so surgery also, there's risk with surgery too, where it could, they could, could lead to hypoparathyroidism, and could affect the laryngeal nerves, and I mean, so again, it's not either way. It's like a lose-lose situation, but obviously there's a time and place for conventional treatment such as surgery. Um, and then as far as if I feel methimazole should be attempted before, you would do a thyroid removal. So if you mean just to take methimazole to see if it'll like get you into remission, I mean, you could try. You could try to take the methimazole, but usually the remission is temporary, just because it's not addressing the autoimmune component. So in all likelihood, even if you got into remission, eventually it would come back. And you asked if you do a thyroid removal, is it possible to have another autoimmune condition? Yeah, I mean, because nothing's done for the reason, so why did your Graves' disease condition develop in the first place? Again, that's the question with everybody with Graves or any autoimmune condition. But again, it's usually, usually have, I mean, there are genetics, but then it's usually one of the triggers I mentioned, food, stress, infection, um, chemical, and then a leaky gut. So if you're not addressing the cause of the problem, so I would say this: if someone needs to get surgery, or they need to get radioactive iodine, if they need to do something else, like let's say they choose to get surgery, you still want to find and remove triggers, and correct underlying imbalances to really. I mean, there's no guarantee you'll get another autoimmune condition. That you just increase risk. A person who has one autoimmune condition, the research does show they're increased risk. So I would want to do everything to decrease the risk. So if you end up, not if you end up getting let's say surgery or radioactive iodine, and this goes for anybody, you still want to do things to improve your immune system health. Well, especially if you have Graves. Not to say you wouldn't want to do it if you don't have an autoimmune condition, but especially obviously Graves is immune. So, okay, private message. Any thoughts on sugar carb cravings when on natural protocol with Graves? Thank you for your integrity in doing this. Yeah, so I mean, sugar carb cravings are common. I won't say it's common just because someone's like following a natural treatment protocol, but a lot of people have sugar cravings, carbohydrate cravings. So again, diet plays a huge role. Certain herbs can help in the meantime, like gymnema is a really good herb, Gymnema, I believe. Gymnema is real good for sweet and carbohydrate cravings. But if someone's eating a lot of refined foods and sugars and lots of carbs, just taking Gymnema by itself isn't going to help. So just blood sugar imbalances. If someone has like insulin resistance, there's usually an inflammatory component. So we want to address that inflammatory component. All right, so we have about 10 minutes until I gotta go, but okay, this question I can't, again, I don't want to mispronounce your name, so I'll just read the question. So I have Graves' disease on antithyroid medication with varying dosage, as 10 milligram increases TSH levels quite high, and if you stop it, then TSH levels drop down dramatically. My doctor suggests we might have to go for radioactive iodine treatment. How can I avoid? Yeah, so really the same. I mean, a lot of people asking the same question. So, just you want to address the cause of the problem. So, and again, diet, stress management, sleep, reduce toxic load, find and remove triggers. I mean, again, not that this is all easy, but just again, it's, yeah, like I said, there's a lot of information on my website too. You might choose to work with a natural healthcare practitioner, or you might just choose to do things initially from a diet and lifestyle factor. And if then things don't improve, to go ahead. And I will say this, I mean, so you're on 10 milligrams and, and like I've had people where 10 milligrams or even 5 milligrams, they're hypo. And if they're off of it, they're hyper, but like half of a tablet, like 2.5 maintains it. Now, again, in a perfect world, we don't want that person in the half, 2.5 milligrams even. But, if that's going to prevent them from getting radioactive iodine until, again, we still want to address the cause of the problem. So temporarily, maybe, I mean, you said 10 milligrams increases, but then if you stop, so there is the option of taking 5 milligrams. Yeah, so which is better, synthetic thyroid, I assume you mentioned, or Armor? I mean, I like, yeah, I mean, I again, everybody's different is the answer, but desiccated thyroid hormone if someone needs thyroid hormone, but there are some people that do better on synthetic thyroid hormone. All right, so Olga, do you have any experience with LDN, low dose naltrexone for thyroid eye disease? I started taking a 1.5 milligram dose daily 3 weeks ago, and I noticed a remarkable improvement. Does this therapy actually tackle the antibodies? Yeah, it's good that you brought that up. I probably should have put that on. I didn't think about that when putting together a slide for thyroid eye disease. I know we're finishing up here, but this is the slide if any of you came in late. For thyroid, so LDN modulates the immune system, and so the problem is it's hit or miss with LDN, low dose naltrexone. So if it works well, like in your case, it sounds like it's working really good. You notice a remarkable improvement, so which is great, Olga. But a lot of people, they take it and they don't notice an improvement. And I'm not just saying with thyroid eye disease. Just with the LDN, low dose naltrexone, could be, and I have some articles on my website too, if you just do a search for LDN, low dose naltrexone. But so you mentioned, does this therapy actually tackle the antibodies? And the answer is yes, it's tackling the antibodies, but like it potentially, if it works, it can lower antibodies, but it's not addressing the cause of the problem. So it's potentially, when you stop the LDN, it'll come back. Now, again, if LDN were to work in everybody, I would recommend LDN over antithyroid medication, because it actually is affecting immune system, even though it's not affecting the cause of the immune system. But there also are some people that, they'll be on like the low dose, of course it's low, that's why it's called LDN, low dose naltrexone, but let's say 1.5, and then they might be under in a few months and it starts losing effectiveness. So then they increase it to 2.5 and, and continue with that pattern. But usually you're not going above like 4.5 or 5 milligrams. So again, I don't look at it as a long-term solution, like a permanent solution. But if it's working, it could definitely buy some people time, for those that work, where it works, where it helps. So I think, and that's another thing, I guess, for those who might be pressured by their medical doctor. It's probably good that this was brought up. If you're pressured to get radioactive iodine or thyroid surgery, maybe get LDN. There's you could even get it without, like, you could speak with your doctor, but some doctors might not be open to it. But you could get it on, like, there's ldndoctor.com, I think is one. Well, they're a little bit pricey, but there's a few websites that like that where you could schedule a remote consultation with a doctor who will prescribe LDN, at least in the United States. I don't know about overseas, it might be available, but there's resources for those, other countries too, but I don't know like that. But United States, there's places where you could hop on the phone with someone, with a practitioner, and for as low as like $100, but or maybe even lower, like 70. There was one site I came across, my staff person came across, I think it was like 75 for like with a nurse practitioner, or $100 for a doctor. I think ldndoctor.com is like maybe a couple of $100, but either way, they'll write a prescription for you for LDN for, I think, 6 months. And I don't think it's too expensive if you're paying out of pocket for LDN. I mean, it's not like I mentioned Tepeza, which is completely different. It's intravenous, but yeah, something, maybe if someone's on the brink of like where the doctor is recommending radioactive iodine, maybe try the LDN, because a lot of, methimazole, a lot of them just don't want you on the methimazole, even if you're on a low dose and it's doing a good job and your liver enzymes look fine, they just won't have their patients stay on it. But LDN, again, it's not a permanent solution usually, but it might buy you some more time, maybe even a few years. So yeah, thanks for bringing that up. All right, so again, a few more minutes. So James, is spirulina and chlorella safe for people with Graves or Hashimoto's? It depends who you ask. I mean, I usually don't recommend spirulina and chlorella, not because there's concerns about it maybe enhancing the immune system response and thus maybe aggravating the immune system response, similar to what I mentioned with echinacea, maybe driving it towards the Th1, like that immune system shift I spoke about earlier, which might not be bad for people with Graves' disease, but it depends. Some people have the antibodies for Graves and Hashimoto's, so they might not be Th2 dominant. And if you're not sure what I'm talking about, you could listen to the recording if you came in late. But I didn't get into too much detail, just because if you're not familiar with that, it probably would be confusing. But you could, if you want more information, also not on spirulina or chlorella, but on Th1, Th2, you could visit my website. I've spoke about like cytokines. Yeah, unfortunately, I don't have articles on spirulina and chlorella, but so I mean, most people will be okay, but everybody's different. And I can't say that with everybody. I know it's not the answer you probably want, but like if someone's taking, like, adding some spirulina powder to a smoothie, let's say, or like there's chlorella in some powders too, honestly, that probably is not a big deal. Again, I can't say 100% it's not a big deal, but if someone's taking like capsules like chlorella for detox to bind to, like heavy metals, again, most people probably would be okay, but there would be some people, it might be like a detox reaction if they have a negative effects. But yeah, so like I said, most people would be okay, but there's always exceptions, so I can't say everybody. All right, so Constance, so question on thyroid eye disease: any non-surgical recommendation on reducing swelling behind the eye? So the slide that's on right now, so you might have trickled in a little bit late, is but we want to address the cause of the problem. And remember that this slide was just, this isn't necessarily a solution. We want to get address triggers, underlying imbalances, with Graves, and if someone has thyroid eye disease, the same thing. All right, so Linda, again, I'm just trying to get to as many people as possible, but I'm gonna have to end this soon because I got a call at 3:15. And again, don't want to need to run to the restroom and all, get ready before that. So, so Linda, does Graves lead to hand tremors? Is there any natural remedy? Not on any medication, eat clean diet and TSH and T3, T4. So it sounds like everything's levels are normal. Again, I would love to see the levels, but so I did have some tremors. They weren't really bad when I dealt with Graves, but I did have tremors. And I mean, in my case, and most people with Graves, like the tremors go away as the thyroid hormone levels are imbalanced. Yeah, I'm wondering if your T3, T4 are still on the higher side, even if they're within the range. But if that were the case, TSH probably wouldn't be normal. So Graves usually doesn't lead to like hand tremors, like, as far as permanently, like someone getting hand tremors. But again, I had actually just it was noticeable in the hands. So yeah, I'm wondering there might be, maybe something else was triggered too. And it's not the Graves if everything else is looking good. If TSH, free T3, free T4, and antibodies are normal. Okay, so Hannah, what supplements or herbs would you recommend to prevent recurrence? Do you advise reishi mushrooms? I wouldn't say for like I don't take the any. I know some people take mushrooms for like supplement with mushrooms, like, or I mean, you could eat mushrooms, that's fine. But you talk about like supplementing as a supplement form. Again, that's something that enhances immune response. I mean, so what I do again, I focus on the basics most of the time. I'm not perfect with diet. I'm not perfect with stress management. I'm pretty good with sleep. Again, I can't say perfect with sleep, but I'm pretty good with sleep and pretty good with diet and stress management. But sleep, again, that's always been something again, I can't say it. It depends. There are some people that are better than me and they go to sleep by like 9 o'clock, but I can't say I'm not good. But um, so I do basics as far as, I mean, I'm not going to list everything here just because of time wise, and I take more supplements than, I can't say everything I take is recommended. I just get exposed to a lot of supplements through like attending seminars, and supplement companies are always contacting me as well. But I can't say always, but again, especially seminars and doing research. Even doing research like COVID-19 and writing some articles and jumping into the research and saying, oh, this, but anyway, I take probiotic, I take vitamin D, I take an omega, I take, in my case, a fish oil. I do take some zinc. I mean, think about immune system. Let's put it this way. I mean, again, and I don't know if you're talking about Graves or but just with Graves, definitely immune system, but just overall, even if you have a non-autoimmune hyperthyroid condition, you just you don't want to have any nutrient deficiencies, just and then, but the big thing again is diet, lifestyle, and so diet, sleep, stress management, the big three. I do a lot to reduce my toxic load. So I do infrared sauna a couple of times per week. I do a few detoxes, I usually do one like once a quarter, like a 3-week, like liver cleanse, or like I've done now since last year, 2 60-day homeopathic, like whole body detoxes. But again, that's more recent. I've been doing, infrared sauna now for, I guess, like 4 or 5 years. I forget when I got it either in 2014, 2015. So it's been a while since I've been doing that. And then again, detoxes I've been doing for a long time. And, just, the probiotic for a long time, the vitamin D for a long time, the omegas for a long time. I can't say other supplements I'm taking that I took for, like resveratrol. Sometimes I mentioned that in one of my recent articles, and that's not a regular one. But that I'll buy every now and then. And, same thing with like curcumin. It's not something I take every single day. I do take magnesium regularly. Yeah. So yeah, but you want to do as much as you can through diet, of course, diet and lifestyle factors. I'm not encouraging people when they're in remission to like take like, a dozen or more supplements. All right. So, unfortunately, I'm going to have to go. I'm sorry. I know there's a lot of questions. As usual, I feel bad about, I've been on for a little over an hour and a half, and, first 15 minutes was just, presenting some slides. So it's been about an hour and 20 minutes of, question Q&A. And again, I wish I didn't have to go, but unfortunately I do. So I will do the next one I probably will do will be an evening one, just to accommodate those who couldn't attend the day one. But I'll definitely consider doing another day one as well. I'm just not sure when. Maybe later this month. I mean, it's already May 12th, but again, I'll try to do maybe this month another day one as well as an evening one, time permitting. But again, thank you, everyone. Thank you so much for attending. I appreciate your time. I appreciate your questions. And let's see. So let me go ahead to Zoom and, okay, I'm going to stop the share here. And then, all right, just going to unmute everybody to say a quick goodbye. And then I got to run. So, all right. Thank you, everyone.
Thank you.
Thank
Goodbye.
you.
Thank you.
I'm waiting.
Very much. Thank you.
Thank you very much.
Bye.
See you again.
Take care. Have a great day.
You too. Bye-bye.
Thank you.
Oh, wait, fire.
Bye.
I can hear them. That means they can hear me.